We all now have figured out that one of the fiascos, if not the fundamental fiasco of the U.S. government response to this crisis, is that there isn't any testing, really. That we are probably the worst in the world, certainly the worst in the industrial world, at testing and screening for this virus. We've got it. We've got it in probably every state in the country. We've got states of emergency in 30 states in the country. We're still not broadly testing populations anywhere. Virginia Congressman Don Beyer, one of those members of Congress who is self-quarantining because he believes he was exposed to the virus, even he, a sitting member of Congress, just outside the nation's capital, even he is unable to get tested while he's under quarantine because we don't have tests that are, not only do we not have widely available testing in this country, if you're a sitting member of Congress, you can't finagle a test in this country. Not unless apparently you've got the right connections. I mean, whether you are in one of the nursing homes where there has been multiple deaths in Washington state, or you just got off a cruise ship that had positive coronavirus cases on board, a cruise ship that was held offshore in California, or whether you went to a conference in New Orleans or Washington, D.C., where people were known to be positive, or Boston, or somebody at your synagogue or your church, or a wedding you went to has fallen ill or tested positive. If you have been somewhere where you believe there is a good chance that you have been exposed to this highly contagious virus, chances are still this deep into it, this long into this crisis, that if you as an American are seeking testing to see if you yourself have in fact been exposed, you are going to have a hard time getting it. Even Americans who have returned from countries that have raging out of control outbreaks have found once they get here, even if they want to get tested, there's not necessarily a way to do it. And while the government is trying to scale this up, Tony Fauci from NIH today saying it is a failure of the U.S. system that we've been unable to scale up our testing. It is a failure. Acknowledging it is a failure is a good first step to fixing it. The CDC director today saying under harsh and persistent questioning from Democratic members of Congress that ultimately, yes, testing will be provided regardless of whether you're able to pay. The government clarifying that for the first time today. CDC director saying today that coronavirus treatment will be provided whether or not you are able to pay. And that is a check that his mouth wrote today that I am looking forward to seeing them cash as a federal government, because I don't know how they're going to guarantee that. But the CDC director today promised it under tough questioning in Congress. I mean, they are trying to improve all of these things. But right now, we're watching the numbers go up everywhere. We know what the infection curves look like in other countries that have community transmission. And we still don't have testing. More than 1,000 confirmed cases in this country, an epidemic of absolutely unknown proportions because we don't have testing. But Americans who believe they've been exposed still have to do something. If you believe you've been exposed, the general advice is that you should isolate yourself, right? Self-quarantine-ish. ProPublica today investigated the specific advice Americans are being given if they believe they have been exposed to someone with the virus. What they found is that instructions people are getting about how exactly you do self-quarantine, how exactly you do isolate yourselves. These instructions are wildly divergent, depending on who you're asking and under what circumstances. It is basically impossible to get an authoritative answer as to what Americans who have been exposed are really supposed to do. And honestly, right now, with no vaccine and no treatment and very, very, very little testing in this country, that's all we've got. We've got these mitigation factors that we can take as a society to close down vectors of likely transmission, large crowds, school settings, sporting events, etc. But for people who've believe they've been exposed, we've got one thing you can do. And the guidance on what that one thing is all over the map. In the absence of testing, this is all any of us can do if we believe we've been exposed. What exactly is it? The lack of clear, consistent advice about how to handle this specific part of America's response to coronavirus is something the federal government could fix over the course of a single day if they put their mind toward clarifying and directly specifying best practices for isolation and quarantine. And they issued that advice nationwide. If they had the authority and the wherewithal to do it, they could do it. But as of right now, even this far into it, it appears to just be chaos.